Hello viewers, welcome to Health Profile. Today we are here at Sunshine Hospital. Dr. Naveen Mehrotra is with us, consultant neurosurgeon. Hello doctor.
Hi. Hello.
It's pleasure having you here.
Yes, same here.
Doctor, what is degenerative disc disease?
You see, degeneration is one which involves whole of the body, and when it involves the spine, it is called as a degenerative disc disease. The spine is made up of two components. One is called as the bone, which is the vertebra, and in between the two vertebra we have which is called as the disc. Disc is very important. You see, when we move our back, it is painless. Okay. But when the degeneration happens, that means the disc loses its height, and then it is called, or it causes pain. So this is called as degeneration, and it encompasses a lot of things and causes the commonest symptom, which is back pain.
So can we take this as a serious condition?
It is not a serious condition per se, but if we do not take care of it, it can lead to a serious problem. So it has to be taken with a caution.
How somebody come to know that they have this problem?
You see, when we have back pain, so normally any point of time anybody will have some back pain, and usually you take some painkillers and it goes away with it.
Okay.
But if you see that this pain is becoming more frequent, it is requiring more of analgesics, it is affecting your work life, and you feel there is some restriction of my activity, and especially if it is happening in young age, then probably you are having some sort of degenerative disc disease which needs to be treated or evaluated.
What are the main causes, doctor?
I think this is a very important question. Why we see our lifestyle has become predominantly sedentary,
Yes.
meaning thereby that we are spending lot of time on sitting.
Yes.
The studies have revealed that sitting is more dangerous than even smoking,
Yes.
or other form of diseases. What happens when we sit for a long period of time, and especially if we sit in bad postures? So what happens? There is a stress on our joints, especially our back.
Okay.
So what happens is that this pressure gets translated, and normally what happens, if you see, this is the bone and this is another bone. In between, this disc is there. Normally this disc should be at least 1/3 of the height of the vertebra.
Okay.
So if we keep on sitting for long periods of time, either by driving or in office, this disc loses the height or loses its hydration, and then the bone ends come together. So you lose a flexibility. So once you lose a flexibility, you get this problem. So as far as I am concerned, I consider sedentary lifestyle, prolonged sitting, and lack of physical exercise is the thing which is causing lot of degenerative disc disease in a or in otherwise healthy individuals.
Doctor, how does degenerative disc disease feels like?
No, it's really troublesome. You see, if we do a random study or do an MRI scan for almost all young individuals, including you and me, we may find that we are all having some form of degenerative disc disease. Okay, but we are living with it.
Yes.
So if you see you are working in an office in a young age, suppose in an IT industry, and you feel you are not able to do your 100% just because of this back pain. The worst part is back pain is not taken seriously either in your office or in a family, but you see it affects your work. So it is I would say it is very discomforting to the individual who has it, because if it comes and if you do not follow a proper treatment or physiotherapy, it doesn't go and keeps on coming up whenever you do some amount of little exercise, a little or extra work. So I will feel it is very discomforting, and it's not a good thing to have it.
Doctor, how do you diagnose it?
You see, diagnosis for the degenerative disc disease is predominantly based on history, meaning thereby once we talk to the patient, we see a young individual who is complaining of back pain. So we know that probably he is having most commonly a degenerative disc disease. But to say that with confirmation, simply we need two tests. One is an X-ray. X-ray will reveal that the disc height has reduced, and an MRI. MRI will show that the normal disc is white colored, it has become black colored, or some form of bulges will be there. But normally this diagnosis is made on history, or secondly you can do a simple X-ray for it. So that's how we diagnose a degenerative disc disease.
Then after diagnosing it, how do you treat this, doctor?
Normally degenerative disc disease doesn't require much of a therapy. It just the sheet anchor for the treatment for degenerative disc disease that you need to modify your lifestyle. Number one. If you have a very severe pain, then we prescribe you some painkillers, bed rest, or some form of restriction of activity, and that's how once the pain is subsided, you can go ahead with physiotherapy and start to strengthen your back muscles. That is the key to the prevention or arresting the or the progression of the degenerative disc disease. Very rarely when you have got a severe disc which has bulged out and is pressing upon the nerve, then you might require a surgical intervention, or if the disc is totally dehydrated and there are osteophytes and the canal is compromised, then you require surgical intervention. But this, when I am saying, it usually doesn't happen in young individuals. It usually happens when you are predominantly middle age or old age. Right now we are concentrating on young, otherwise healthy individuals who, because of their improper posture or sedentary lifestyle, develop this degenerative disc disease.
How do you perform your surgery?
So surgery, right now you see the surgery for the low back or degenerative disc disease, right now we are concentrating predominantly for the low back, has evolved much. Initially we used to give big incisions, we used to retract and then try to remove a big segment of the bone, and there were a lot of myths associated with the spine surgery that once you get operated you will be bedridden and you will not be able to do a lot of activities. Now that has definitely gone a change with the improvement of our understanding of the biomechanics of the spine. So right now we do surgery with a small incision called as minimally invasive surgery. The patient gets investigated, gets admitted on the same day, we operate on the same day, and he goes to the ICU and he walks the same day. Sometimes maybe if he has a lot of pain, and otherwise the next day he goes home. And there is nothing called as bed rest. You have to limit your bed. You can do activities of daily living, but don't strain too much.
Okay.
So it's a relatively safe surgery with a good outcome.
After the surgery, they may have any side effects, doctor?
Side effects are very, very rare. You see, any surgery which we do has some side effects. But the side effects or the chances of having a side effect are much less, are very, very less compared to the outcome. So if you have a diseased nerve in which you are not able to walk, it's just like a switch. You switch off, the light goes, you switch on, the light comes. So if you do a proper surgery, you select a good patient, the outcomes are really too good. I would not say side effects, I think, should not be the one that should deter you from getting this simple surgery.
Doctor, does everyone get DDD?
You see, degeneration all of us will get. We all are, once we are born, we are definitely will get old. You see, our skin will get wrinkles, our hairs will become white. So degenerative disc you are bound to get. But if you get around 60 years of age, that is what is expected of you. But when you get at 30 years of age, then it is not normal. So if it's happening in young age, maybe 20s or late 20s or 30s, then it is abnormal. But when it happens in the middle age individual around 50-60 years of age, then it's taken as a part of a normal aging process.
How do we avoid it, doctor?
Number one, regularly exercise. I think there are two very simple exercises. One is walking. Anybody can walk. I don't think you require something extra to walk, but you should be motivated to walk. Normally we see that ladies or whatever we get the patient, they say they walk throughout the day. I don't think so. What happens? Doing your work does not constitute an exercise. Don't substitute your daily work with exercise. So exercise should be like at least when you walk for 15-20 minutes, when you get warmed up, that is the time your body starts to exercise. So if you walk less than that, practically you have done the exercise, but your body doesn't get benefit out of it.
Okay.
So exercise, something like walking or swimming. So if you want to avoid this problem, do regular exercise. That is the key word.
Doctor, if it is not treated, it get worse?
Suppose even you have tried all possible means, you are living a healthy lifestyle, but you see that the back pain is still persisting and affecting your work, then definitely you need to consult a doctor and needs an investigation. It may be degenerative or it may have some other problem also. So then that needs to be ruled out. But majority of the cases, it will solve your problem.
Doctor, are there any diet plan they should follow?
You see, normally what happens, the entire weight of our body is being carried through the spine. So if we are overweight, we are putting extra load or strain on our spine. So definitely if you have a weight control or that definitely leads you or avoids lot of degenerative problems of the spine as well as the joint. Definitely you should keep your weight under control. You can follow diet or exercise. If you say that you can't diet, then exercise more.
Doctor, would you like to say something to our viewers?
You see, a healthy back leads to a healthy life. Normally it's our tendency to ignore back pain, and then we see that okay, it's just light pain, it will improve. Nothing improves on its own. then you have to really think about it. And if it's not too difficult, or it's that you require some, majority of the patients, they improve with the consultation and some physiotherapy. So my advice to you, or my word of caution to you, if you have a sore back, if you have been having it regularly and you see that the frequency of the pain is increasing, if you feel there is restriction of movement, you are not able to carry out all your activities, then please consult a surgeon or a doctor and try to figure out what is the cause for it. Majority of the times it doesn't require much of a treatment. It just needs a bit of modification and a therapy.
Thank you, doctor. Thank you so much for your time.
Thank you.
Thanks for watching this video, and don't forget to like, share, subscribe to the channel. To get latest updates and notification, click on the bell icon. Tell me something about hair loss.
See, hair loss is a big thing as such. These days it's affecting everyone because of this. You are having a lot of psychological issues. It could be diffuse hair loss, or it could be a localized thing. Diffuse hair loss, you have it in males and in females. It's because of the hormonal changes. It is known as androgenic alopecia.